All right, I'll get started. I'm Jill Speece. I work for Radiology Associates. I'm the Director of Business Optimization. Unfortunately, my co-presenter could not be here today, so I'm going to take over her section and do my very best to honor what she wanted to share. So I'm going to share with you our care in a crisis formula. So we've been around for more than 60 years. But in the last 7 years is when we've really committed to a culture of continuous improvement, because the COVID pandemic is not the first crisis we've encountered. Back in 2013, we had really significant reimbursement cuts that forced us to find a new way of doing business. We used to make decisions kind of based on emotions. And so now we're learning, and we've been learning, how to make decisions based on data. And thank goodness we are committed to process improvement, because we have a flexible formula for navigating any crisis situation. So our care formula for success is calculate your numbers, allocate resources, rubber stamp future work, and experiment constantly. A little bit of background on our business. We are located on the central coast of California between San Francisco and Los Angeles. We operate 3 outpatient imaging centers. We perform MRIs, CT exams, mammograms, x-rays, ultrasound, and PET scans. We see on average 485 patients a day at these 3 locations. We are also contracted with several local hospitals to provide physician services on site. We have 134 employees and 22 radiology physicians. Our business model greatly depends on our local primary care physicians, orthopedic surgeons, oncologists, and other specialists for our referrals. And that's really important to understand as we talk about the demand changes we were seeing. So what can I say? What can I say about last year's crisis that you already don't know? I have to let you know that we started 2020 with the goal of stability for the year. We actually called it Stability 2020. We didn't want to do anything new and crazy last year. We just wanted to monitor the impact of previous initiatives. Let me tell you, we'll never start the year again by declaring stability as our goal for the year, because it was not a stable year. So initially, at the beginning of the pandemic, there was a real lack of information. And so our staff were really stressed out. A lot of our staff members, our technologists, our front office staff, our radiologists still needed to come into the center to see patients. And that was concerning when we didn't know exactly what we were supposed to do initially. And we had staff members that were concerned about how close they needed to be to the patients. We had nervous patients, so they still needed to come in to get the care that they needed, but they were concerned about their proximity to our staff and to other patients. School closures were a real concern. A lot of our staff have school-aged children who were now home, and so that greatly affected our staff availability. And we pretty quickly saw a forecasted decline in revenue. So what did we do first? C, the C is for calculate your numbers. So we started by creating a really simple capacity model that automatically pulled our historical demands. We then created variable inputs for each resource that could be adjusted depending on equipment and personnel availability. This is really important to understand, because if we have 2 technologists available to a room, the exam time is less than if there's one technologist available who also has to do all of the prep tasks for the patient. Staffing availability was really greatly affected by school closures, so keeping close tabs on this was really important. The capacity model that we created was built in Google Sheets and used inputs from subject matter experts. We did not have time to perform a whole new time study. We just used historical data combined with subject matter expert inputs and decided being 90% comfortable with the data is good enough. The capacity model forecasted future utilization using a 5-day rolling average because things were changing that quickly. The A is for allocate resources. So in a crisis, kind of the job description goes out the window, right? So tasks no longer need to align with the individual's job description. With referring offices reducing hours, temporary closures, and a lot of elective surgeries being postponed, our patient demand decreased. So there was less need to schedule patient exams. That allowed us, with less demand in our scheduling area, to move some of our scheduling staff into our billing and collections department. We moved our front office receptionists to become triage medical aides, and they were tasked with, making sure that everybody entering the building was healthy and limiting the number of people in the building. Our business development analysts worked insurance authorizations because we had less work on the business development side. And our radiologists also consolidated shifts. So tracking the demand allowed us to reduce and consolidate radiology shifts between our outpatient centers and the hospitals. So while allocating resources was challenging, looking back, it really brought the organization together as one large team for the same purpose. The R is for rubber stamp future work. As previously mentioned in the allocation of resources, we moved additional staff into our collections department. This allowed us to increase revenue collections that otherwise would have been collected in the future. They enabled us to keep a consistent cash flow coming into the organization, pay our bills on time, and most importantly, make sure all of our staff received regular paychecks. And the E is for experiment constantly. The management team instituted daily meetings to review the projected utilization and update the center hours, exam hours, and staff schedule for 5 days out. This information was then communicated to our staff as quickly as possible and our marketing team to keep our referring physicians and patients informed. We also regularly reviewed the ever-changing CDC guidelines and made updates to our visual flow map for the triage process and ensured that that information was communicated immediately. This visual process flow map that we created became a standard operating procedure that has been through 9 revisions in the last year. So that's it. This is our care formula. It is our roadmap for navigating a variety of crises in the future and ensuring we make data-driven decisions that best support our staff and our community. Any questions?